Hello everyone, this is our presentation on Merck & Co. and its supply chain issues. My name is Zahra Khalani and I am on Team Impact. My other group members include Cheng, Ihechere, Jasmine Anderson, and Luisa Gallegos. In today's presentation, we will be reviewing how Merck & Co. has overcome and is currently overcoming the supply chain problems that are faced by most large pharmaceutical companies. On this slide, we have a chart representing Merck & Co.'s top 10 products. The products include Keytruda, Januvia, Gardasil, Janumet, Proquad, Zepatier, Zetacia, Icentress, Remicade, and Simponi. Among each of these 10 products, there are different supply chain issues facing Merck & Co. For example, the growing popularity of Keytruda and Zepatier makes it difficult to implement a replenishment program with its distributors, causing potential shortages. Before we delve into the different supply chain issues, here is a breakdown of what each drug is useful for so that you may gain familiarity with each of Merck & Co.'s products. The first is called Keytruda, which is a skin and lung cancer treatment. The next is Januvia, which treats type 2 diabetes. Gardasil prevents HPV, which is a type of cancer. Janumet treats type 2 diabetes. Proquad is a vaccine for measles, mumps, and rubella. Zepatier treats hepatitis C. Zetacia treats high cholesterol levels in plasma. Icentress is a HIV medication. Remicade is used to treat Crohn's disease, and Simponi is used to treat rheumatoid and psoriatic arthritis as well as spinal arthritis. Next, we will have Luisa point out Merck's issues and goals as well as solutions to those problems.
Thank you, Zahra. My name is Luisa Gallegos, and I will now introduce the goals and issues of Merck & Company. There is one major issue with Merck & Company, and that is in the supply chain area. An inefficient supply chain could attribute up to 35% of the pharmaceutical industry losses. Under the one big issue, there is a series of smaller issues, such as Merck's ability to minimize storage space, the unnecessarily long lead times, and other logistic costs associated with the lack of internal data. In the last few years, Merck has come up with valid and functional solutions to the issues listed before. I will go over them after I talk about Merck & Company's goals. Merck & Company have three main goals. The first one is to go through the digitization process like every other successful company in the 21st century, and their second goal is to optimize supply chain management within the company by managing supply in relation to customer demand. Merck's third goal is to increase overall supply chain efficiency through supply chain management methods such as Lean and Six Sigma. Where there are issues, there are also solutions. After understanding what Merck's issues are, top-level management implemented a series of changes through the company's supply chain system. There are four big things that are significant enough to be mentioned here. The first two is in relation to supply chain management methods, while the second two are in regards to Merck's and Company's connections to the digital age. The other minor changes are not mentioned, not because they are unimportant, but because they look like general housekeeping tasks in comparison to these four. First, to increase the efficiency, Merck & Company shifted its focus from node-to-node supply chain to end-to-end supply chain. My teammate Jasmine will explain what they are in the next few slides. The second thing is supply chain integration and transformation. Here's how Merck plans to utilize their end-to-end supply chain and what potential benefits it can bring. Also, Merck developed ways to better manage supply through effectively meeting the goal they had in the previous slide. The third is both a solution to the issue and an answer to a goal Merck had. They implemented a more effective planning process through a program named Rapid Response. The program allows the company to supply chain quality high quality products to its customers in the quickest way possible. My teammate I will go further into this topic. Lastly, the fourth thing Merck is planning on doing is creating a self-driving supply chain with the aid of artificial intelligence. Unfortunately, this technology isn't there yet. After I goes over rapid response, my teammate Hao will explain Merck's digitization process and how much it benefits Merck's has harvested from it.
Thank you, Louisa. My name is Jasmine Anderson. I will go over node to node supply chain. Node to node supply chain. Node to node supply chain is what Merck had before they made the switch to the end to end supply chain. They made the switch because node to node supply chain had several issues that increased cost in Merck's supply chain process. Node to node was causing cost related issues for Merck because items can only move from one node to another, and the movement itself created increased cost. Based on the illustration, to move a product from purchase nodes to sales nodes, it will take 3 extra steps related to distribution. The 3 extra steps on distribution significantly increase cost in Merck's supply chain. Another issue for node to node is the 2 extra steps in Merck's supply nodes. They did nothing but increase complexities while providing almost zero benefits. Merck realized the issues they had to face with their node to node supply chain. In order to resolve those issues, Merck switched from node to an end to end supply chain. It is further explained in the next 2 slides. End to end supply chain. The main concept for end to end supply chain is to provide a more streamlined process in a company's total supply chain system, where all supply chain and logistics processes are connected. End-to-end supply chain uncovers waste reduction opportunities a company can take to create speed and flow, thus reducing operating cost and inventory. Why Merck is building an end-to-end supply chain. Well, there are quite a few reasons as to why Merck is building an end-to-end supply chain, but the main one here is to optimize planning platforms. Creating DRP, Demand Requirements Planning, on top of its traditional ERP, Enterprise Resource Planning platform. By doing so, Merck gathered benefits in 3 unique areas. The first one is inventory. End-to-end supply chain helps to manage inventory replenishment process and distribution channels, effectively reducing errors. The second benefit is the waste reduction, saving costs significantly by reducing waste by half. Lastly, the third benefit of an end-to-end supply chain is that it identifies early signs of potential issues through changes in workflow and parameter management. Ike will now introduce supply chain transformation initiatives.
Thank you, Jasmine. My name is Ikenna. I want to discuss how Merck's company are trying to resolve the supply chain problem faced by most pharmaceutical companies in the world. This company was able to do this in 2 ways. One is by creating a supply chain transformation initiative. Through this initiative, we were able to develop a global demand planning that drives the fulfillment process through statistical forecast, which utilizes the pull planning model instead of the push. Secondly, the global supply planning that helps segment analysis, which enables the company to differentiate inventory policies. 3. Through the same initiative, we were able to develop a distribution requirement plan that helps plan different replenishment strategies and create inventory replacement levels and other points. Lastly, they were able to create a sales and operation planning that enables better decision making and assessment of alternatives by the usage of better modeling scenarios. However, in order to solve the supply chain problems, Merck and company decided to go into alliance with Kinesis Rapid Response. By having a close collaboration with Kinesis, Merck and company was able to optimize its supply chain process. As a result of this collaboration, there are benefits that includes 1. Global visibility of inventory for all finished goods. 2. Exception-based planning for minimum and maximum inventory levels. 3. Replenishment strategy that is implemented across all sites and hubs. From this collaboration, we were able to create a rapid response algorithm that is being used to leverage performance through rough cut capacity planning, attribute-based planning, multiple level expiry planning, and my friend Ho will go over how Merck and Company are trying to lower their supply chain costs? Thank you.
Thank you, Ike. My name is Hal. I will go over how Merck is lowering its supply chain cost. Merck is reducing its supply chain cost in a three-step process. Step 1 is digitization. Like most companies that survived to the late 20th century, Merck effectively utilized the internet. It started with one website for the entire company. As time passed and technology became further developed, individual websites were created for each product the company offers. Of course, that's only the beginning of supply chain digitization, knowing what you have. The next two slides will explain more on this topic. Step 2 is a transition from air freight to ocean transport. Merck joined the Poseidon Initiative in early 2018 for three reasons. Reason 1 is that only 15% of medical shipments are time sensitive. That means the other 85% have relatively lower time sensitivity, which means they can be transported via ships instead of planes. It'll take longer, but it'll cost less. Reason 2 is that air freight accounts for 80% of all reported temperature excursions, while ocean transport only accounts for 1%. In this case, both cost and waste are reduced significantly. The third reason, also the most important reason, is that ocean transport is 80% less expensive than air travel. Based on the numbers, the global pharmaceutical logistics market is valued at $64 billion US, and 80% of that is $51.2 billion. That's an extremely high number in cost reduction. Step 3 is Merck selling its non-prescription drug sectors. Management had been looking for a buyer for its non-prescription drug sectors since 2017. Those sectors were sold to Procter & Gamble in April 2018. I will expand on this topic after the digitization slides. Merck's digitization of drug supply chain. The main reason for Merck to go through the digitization process is for cost savings. As mentioned earlier, supply chain issues account for 35% of pharmaceutical industry's losses. That means with an efficient supply chain, profit could potentially increase up by 35%. Considering that the pharmaceutical industry is worth $450 billion US today, 35% is a lot to any company. Cost savings is not the only benefit digitization can bring. It also helps management make better plans based on data. It helps reduce waste, and it allows Merck to have a better handle on demand spikes and manufacturing disruptions. Digitization is overall a great idea, but why did Merck wait this long? Well, pharmaceutical companies are not like, say, consumer food companies. Since drugs are a lot more dangerous than chips, Merck is hesitant with change, because human lives could be at risk if anything goes wrong. To avoid lawsuits and deaths, Merck partnered with professional firms that can help it get into digitization. Digitization partnerships. Merck built partnerships with firms that have focused on big data and supply chain analytics in its effort to go further in its digitization process. The big data firm is named Palantir. Merck's partnership with them allowed Merck to accelerate the research and development phase of its go-to-market process and reduce drug developmental cost. Merck used Palantir's analytics software to predict which patient will respond best to certain drugs. By doing so, Merck is able to provide drugs to patients who can respond with the best anticipated response. It's overall a great idea, but there's an issue related to that. Merck utilized the software even in the R&D process of different drugs. It's the reason why Merck was able to reduce developmental cost. I think it's both an issue and a benefit for the patient. Instead of a random selection of samples, Merck's selection of its clinical trial group is carefully controlled in order to provide the most positive results. It's an issue because it overlooks the patients with less than optimal results. But it's beneficial at the same time because the patients they're helping know that there's a pretty good chance they'll be cured. The name for the supply chain analytics firm is Era. Era helps Merck management make better decisions by providing data illustrations that are easy to understand and real-time visuals that can help Merck measure product performances. Visuals and illustrations are helpful, but the most important thing Era is doing for Merck is supply chain automation. Automation enhanced Merck's ability to predict and satisfy demand and assist in creating plans based on demand requirements. Merck & Co. relations with Procter & Gamble. As I had mentioned earlier, step 3 of Merck's goal to lower supply chain cost was to look for someone to buy its non-prescription sector. In April of this year, an agreement was reached between Merck and Procter & Gamble, also known as P&G. Through countless negotiations, P&G agreed to acquire the consumer health business from Merck & Co. in a $4.2 billion deal. The deal provided benefits to both P&G and Merck. The deal added vitamins and food supplements to Procter & Gamble's lineup of over-the-counter medication. As for Merck, it gained a large sum of cash inflow, the ability to focus more on research and development of prescription drugs, and a chance to improve distribution system now that everything is prescription-based. And that concludes our presentation. Thank you for listening, and have a nice day.